doing med administration today. Delana is going to be my evaluator and Isabel is going to be my videographer. So I'm going to go ahead and get started. Jamie Wheeler is status post right knee arthroplasty 2 days ago. The patient is preparing to go home today. The patient is recovering well but has a past medical history for DVT with IVC filter in place. The patient has not had a bowel movement since the day of admission. The patient has not received the influenza vaccine this year and the provider has ordered it to be given before discharge. Okay. So I'm going to go ahead and check the provider's orders. Okay, so this is Jamie Wheeler, date of birth 10/31/1947. He has an allergy to codeine. So the doctor had ordered an influenza vaccine, 0.5 milliliters intramuscularly 1 time now, at 8. Colace, 200 milligrams by mouth daily. I'm going to give that now at 8. And then heparin, 5,000 units subcutaneously every 12 hours. I'm going to go ahead and give that now. Okay, at 8 a.m. All right, next, and then we'll look over them all. Once again, I'm going to see that he has an allergy to codeine. This is the right patient, Jamie Wheeler. Birth date 10/31/1947. Okay, so I'm going to start getting out my meds. First, this is Jamie Wheeler, influenza vaccine, 0.5 milliliters intramuscularly 1 time. I'm going to give that at 8 a.m. So now. I'm also going to make sure that the drug is not expired, which it is not. Okay, next we're going to be giving Colace. Okay. We're going to be giving Colace for Mr. Jamie Wheeler, 200 milligrams by mouth daily, and since each one of these is 100 milligrams, I'm going to be giving 2 because it calls for 200. I'll give that now at 8 a.m. I will also make sure that it is not expired. Perfect, not expired. Okay, then I will be giving heparin, 5,000 units subcutaneously every 12 hours for Mr. Jamie Wheeler. I'm going to see that 5,000 units converges to 1 milliliter, and I'll make sure that it is not expired, which it is not. Okay, next I'm going to get out my needles. Okay, so for the influenza and for heparin, I'm getting out two 3 milliliter syringes, 18 gauge by 1.5 inch to withdraw the medication. And then I will be using the needles. Okay. So for the influenza vaccine, the intramuscular, I will be using a 23 gauge by 1 1/4 inch needle. And for heparin, the subcutaneous, I will be using a 25 gauge 5/8 inch needle. Okay, so I'm going to check one more time before entering the patient's room. This is my second check. So for Jamie Wheeler, this is the influenza vaccine, 0.5 milliliters intramuscularly 1 time. Next, Colace for Mr. Jamie Wheeler, 200 milligrams by mouth daily. Each of these is 100 milligrams, so I'm going to make sure I have 2 of them. And then lastly, for Mr. Jamie Wheeler, we have heparin, 5,000 units subcutaneously every 12 hours. 5,000 units is converged to 1 milliliter. I'll give that now. Okay, so now I'm ready to enter the patient's room. Hi, Mr. Wheeler. My name's Erin. I'm going to be your student nurse today. I'm just going to check your name. Can you state your full name and date of birth? Okay, perfect. I do see you have an allergy to codeine. Do you have an allergy to anything else? Okay, perfect. So I am going to get set up. We're going to be giving you medication today. If you have any questions, feel free to stop and let me know. Other than that, I will be getting set up over here, and I will also close the curtain for patient privacy. Okay. Also, really quickly, I just want to verify to make sure that you can swallow. because we will be giving you oral meds today, so no issues with that. Okay, perfect. I also am really quickly going to be checking your tissue integrity for the injection sites I'll be using. So no bruising, masses, sores on the abdomen. Check the deltoid. Perfect. Okay. So the first thing that I'm going to be... Just a water cup. Okay. I've gotten a new one. Okay, so the first thing that I will be giving you is Colace. This is to prevent constipation, and some common side effects will be mild cramps and diarrhea. Okay, so if you have any of those side effects, let me know at any time. I'm going to get them set up. Okay, once again, this is Colace, 200 milligrams by mouth daily for Mr. Jamie Wheeler, 100 milligrams in each. Okay. Now on the bed, the head of the bed is rose up high enough. Okay, I'm going to give this to Mr. Wheeler. Okay, perfect. And I'm going to make sure that the patient did swallow the medication. Okay. So next what I'm going to be giving is an influenza vaccine. So I'm going to go ahead and get set up. So this is for Mr. Jamie Wheeler, the influenza vaccine, 0.5 milliliters intramuscularly one time. Okay.
I'm sorry. I threw it. I would just say, like, well, she did say what the medication was. So when she grabs them, she falls on her.
Okay, I will withdraw 0.5 milliliters of air. Go pass because I have some air in there. Make sure there aren't any air bubbles. Perfect. Okay, once again, for this intramuscular vaccine, I will be using a 23 gauge by 1 1/4 inch needle. Okay, so I am going to read off to you what this is. So, Mr. Wheeler, this is a flu vaccine that prevents the influenza infection. Some common side effects that you may experience are local soreness, fever, and myalgia. So I'm going to go ahead and get the site ready for injection. Okay, so we're going to be using 2 fingers down from the acromion process. Sorry. There. Okay, I'll put that there. Make sure that I cleaned it. This is the right vaccine. Okay, we'll be using Z-Track. And on the count of 3, slight pinch, 1, 2, 3. 90-degree angle. I'll leave this for about 10 seconds. Okay, perfect. Good job, Mr. Wheeler. Okay. Throw some of this stuff away really quick. Alright. So lastly, we will be giving heparin. Heparin 5,000 units subcutaneous. This is a high alert drug, so I'm going to have Delana come and help double check with me. This is for Mr. Jamie Wheeler, heparin 5,000 units. That's converged to 1 milliliter, subcutaneous every 12 hours, and it's time to give it now. Okay. So I'm gonna. Okay, once again, 5,000 units is converged to 1 milliliter, so I'm going to withdraw 1 milliliter of air. Okay. Sorry, there's barely any meds left in this. Yeah, I think I'm gonna have to get a new vial. Okay, so I will get a new vial of heparin. Not enough in this. Okay, so I'm gonna check one more time. 3 more times, actually. Okay, so heparin 5,000 units subcutaneously. Check every 12 hours, or administer every 12 hours. Subcutaneous, 5,000 milliliters. Our units is converged to 1 milliliter for Jamie Wheeler, so I check that. Then I check it before I enter the patient's room. This is heparin 5,000 units subcutaneous every 12 hours for Jamie Wheeler. That's converged to 1 milliliter. This is a high-risk medication, so I will have Delana check it with me. This is heparin 5,000 units subcutaneous every 12 hours for Mr. Jamie Wheeler. The 5,000 units is going to be converged to 1 milliliter, and I will be using a 3 milliliter syringe with a blunt-filled needle tip and a 25 gauge needle by 5/8 inch. I also will check that this medication is not expired. So I will draw 1 milliliter of air. Make sure there are no air bubbles. There are.
This is also a higher medication, so I'm gonna have some
Okay, and before I administer this drug, I'm going to explain it to Mr. Wheeler. Alright, so this is a heparin medication given subcutaneously. It is prophylaxis and treatment of various thromboembolic disorders, including venous thromboembolism and pulmonary emboli. Some common side effects may be bleeding, anemia, bruising, and tenderness at the injection site. So I'm going to go ahead and get this site ready.
our
it's going to be 2 inches away from the umbilicus.
And then we have 11 more, which is in the 10 units, and we're gonna about 17.
Okay.
Okay, perfect.
Okay. The lid is on this, so it is fine. The needle did not get contaminated. Okay. Slight pinch. I'm going to give this at a 90-degree angle. 1, 2, 3. I'll leave it there for about 10 seconds. Perfect. Good job, Mr. Wheeler. Okay. All done with that. I'm going to clean my station a little.
So again, I'm checking the monitors before I put this medication to the patient. So we have their vaccine and
So I will lower the bed, make sure that all safety precautions are in order. I will be back in to check on you in about 30 minutes to make sure that none of the side effects taken place. You also have your call light right here, just in case any of those side effects I listed earlier do tend to happen. I'm going to make sure you have no skid socks, your personal items, no IVs hanging. I'll lower the head just a little bit. Okay, and if you have any more questions, once again, your call light's right there. Let me know if you have any questions. Okay. All right. Okay. So what I will be evaluating for, after I leave the patient's room, I will evaluate for a soft formed bowel movement, usually 24 to 48 hours. Therapy may take 3 to 5 days for results. I will also be evaluating, that's for colace. And then for the flu vaccine, I will be evaluating for prevention of disease through active immunity. And then for heparin, I will be evaluating for prolonged partial thromboplastin time, PTT, of 1.5 to 2.5 times the control without signs of hemorrhage, prevention of deep vein thrombosis, and pulmonary emboli. Okay, so now I will document. Okay, so I gave the influenza vaccine at 8 o'clock. I gave that in the deltoid, so the right upper arm. Intermuscularly, the date is 10:30, and my initials. The colace was given at 8. It was given by now. Today's date, my initials, and then lastly the heparin was given at 8. This was done in the right abdomen. Subcutaneously, my initials and the date. Okay, I'll sign here, my initials, and that should be it. Thanks.